Well, it's 2 o'clock, and we will just give it maybe just one more minute,
Okay.
and to allow some others to join. It's like we have some people joining.
Hey, Joe, would you like to give us a little bit of information about your organization while we're waiting?
Yes, and actually we will do that. And just as soon as we get started with introductions, and actually what I was going to do, she doesn't know it yet, but I'm going to ask Jan to talk just a little bit about the Wyoming Primary Care Association. So if you would do that.
Oh, okay.
Yeah.
Okay, sorry, I got ahead of myself then.
No, quite all right, quite all right. Thank you. Thank you
Thank
for
you.
your interest. Okay, well, it's 2 after 2, and our workshop today is going to be packed with information. I think we're going to be struggling to keep this within an hour, so we really do need to get started. I just want to welcome everybody to this Medicaid program and eligibility workshop. My name is Joe Rivera. I'm a consultant, private consultant, working with the Wyoming Primary Care Association and providing training and technical assistance to for the association to our community health centers on outreach and enrollment issues. So that's my role here. I again want to welcome everybody. This is going to be a great workshop. I got a sneak peek at the content, and this is going to be something I think everybody will really enjoy hopefully learning some new things about Wyoming Medicaid and some different categories. So we're going to go ahead and get started with some introductions for those in the room. And we're going to start with the community health center staff that are on this call right now. So please, let's go ahead and I might just call on some of you to get the ball rolling for us. And we're just talking about the health center staff right now. Carrie Pardee, could you please introduce yourself and where you work right at the moment?
Thank you so much, Joe. Sorry, I'm like kind of just with my phone and my computer right now, so let me know if you guys can't hear me very well. But
we can hear you.
I'm here currently at the Community Health Center in Casper, Wyoming. I've been assisting this would be my 5th year. And then I also help with Medicaid enrollment and sliding fee scale. I am leaving the health center though. My last day is on Friday, and I'll be working at the public library here in Casper. So I'm hoping maybe at some point I might be able to continue assisting in that role over there. So that's my goal. Because I really am going to miss what we do, and I think it's so important, and it's really impacted me a lot in the last few years. I'm just grateful for all of you guys, all of your support, and having this kind of training today.
Okay, great. Thank you so much. And we are going to miss you, Carrie. So thank you for that, and for all your years of service at your health center on behalf of your patients too. So, all right, let's go ahead and move on. I see we have a Kay Allen also on here. If you wouldn't mind, please, if you're okay doing that, just please give us your name and where you what health center you work at.
Okay, my name's Karen Allen, and I'm at HealthWorks Medical Clinic here in Cheyenne, Wyoming, and I am the
Okay, thank you very much. And let's see, on my screen, I have next Raquel. Could you please give us your name or introduce yourself for us, please?
Yes, I am Raquel Guadarrama. I'm with we are Bear Lake Community Health Centers, but we are in Wyoming. We have a clinic in Evanston and in Rock Springs, and we assist patients in applying for our marketplace and Medicaid in Wyoming, even though we're here in Utah. So, and we
All right.
actually have, Joe, I'll quickly, we have 2 new ones also attending that are part of our clinic. So just so you know as well.
Fantastic. Okay, great. Well, we hope to hear from them too. Let's see, next on my list, I've got Mr. Bailey. Would you please introduce yourself?
Yeah, I'm Judd Bailey. I'm also with Bear Lake Community Health Centers.
All right, thank you. And Courtney?
I'm Courtney Mason. I'm with Wyoming Primary Care Association.
Okay, thank you, Courtney. I should have recognized your name. I thought that was a little familiar, so thank you for that. And then we have a Nikki on the line too. If you could please introduce yourself.
Hi, we're University of Wyoming Family Medicine. I'm Cecilia, and we have Jesse and Dr. Stock with us today.
Great. Thank you so much for that.
Yeah.
Let's see. We've got also a Crystal. Crystal, could you please introduce yourself? Okay, she might not be on right at the moment. That's okay. We'll move on. Let's see. Nadine. Okay.
Hello.
She's with our clinic as well.
Oh, hi, Crystal. Okay.
Hi, my name is Crystal Chavez, and I'm with HealthWorks.
Okay, thank you very much. All right, and then we've got Katya on the phone. Okay. All right, maybe in a minute. All right, and I did want to mention too, if she would please do this, Renee Martinez. She's with CMS. Renee.
Yeah, hi guys. I'm trying to turn my handy dandy video on here, but yeah, thanks for introducing me. My name is Renee Martinez. I'm with the Centers for Medicare and Medicaid Services, and I'm just here to listen in. And Jan, I see you up there. Nice to see you again. So you guys use me as a resource, and I'll be talking to you about that, not today, but at a later time. So just here to listen in. Thanks.
Thanks.
Okay, great. Thank you. I just want to also mention, this is going to be mentioned a number of times during this workshop. This is really a beautiful opportunity to engage with these folks from Wyoming Medicaid. Any questions that you have, you'll have the opportunity to chat the questions or ask them. We're going to have question and answer sessions after each section of the presentation, and then at the end. And so with that, I'm going to just real quick turn this over for some housekeeping to Devin Spencer, who is our host.
Hey everyone, it's great to see you all. Excited to learn about some Medicaid stuff here in Wyoming. My name is Devin. I'm the training manager here at Wyoming Primary Care Association. And so every training we do, we just like to go over a couple of things. So we do ask you that you stay muted while people are presenting to give them the respect. If you have any questions, please feel free to put them in the chat box, and then we'll go over them when we have time for questions. There will be a link for a evaluation at the end. Since we did not have everybody register through Zoom to attend this meeting, I'd like to get an attendance. So everybody that's in the room with you, just fill out the quick survey. It's a few questions. It takes 3-4 minutes to complete. So I'll be sending that out in the chat as well for everybody. So with that, I'll hand it back.
All right, thank you, Devin. And just to let you know too, we're going to try to end just a little bit before 3 o'clock, so that everybody has the time to fill out that survey, while we're still on the meeting. If we would just ask if you could kindly do that, we'd sure appreciate that. So now, without further ado, I would like to introduce you to Janet Reifsnyder. She is the eligibility, the assistant eligibility and vendor and contract manager for Wyoming Medicaid. And so we're very happy to have her and her team on to present this information about Medicaid, some different categories, and hopefully you saw what those were on the agenda. So without further ado, I'll allow Janet to introduce herself and her team.
Well, welcome everyone. I'm so glad we were able to do this for you guys today. I have three very knowledgeable folks. We've kind of broken it up into three categories. Children and family programs. Jamie Savage will be going over that, which is kind of the Medicaid 101. And then we have Kathy Ernst, who will be doing the MSP Medicaid savings programs. And then I have Susan Holt, who will be going over the long-term care programs that we have. So Jamie, if you're ready to display your screen, and we'll get going.
Is everyone able to see that screen?
Yes. You sure can.
Okay, perfect. So my name's Jamie. I'm the Benefits and Eligibility Analyst. I do mostly the children, family, Medicaid benefits, foster care. I work with DFS as well as the Child Support Division. So we'll go ahead and get started. So what is Medicaid? Medicaid is a state and federal partnership that provides health coverage for selected categories of individuals with low income and limited resources. Wyoming Medicaid provides healthcare services to different populations within three major categories. Those include the family and children, which are known as our MAGI programs, Medicare savings programs, and the aged, blind, or disabled program. So this PowerPoint that I'm going over will focus on the family and children's programs. The Wyoming Department of Health conducts eligibility determinations throughout the state through the use of a customer service center for the following programs. Those include newborns, child MAGI, family MAGI, pregnant women, foster care, and kid care CHIP. So the categories of eligibility for the family and children's programs are broken down by children, pregnant women, and family MAGI. The children include newborn, and a newborn is automatically eligible for Medicaid if it's a baby born to a Medicaid eligible mother up until the age of 1. Child MAGI is children 0 through age 5 with family income at or below 154% of the federal poverty level. Children 6 through 18 with family income at or below 133%. Foster care is children in DFS custody, including some who enter subsidized adoption or who age out of foster care. But most of that information that we get to put kids on those programs comes directly from DFS. Kid Care CHIP is children 0 through 18 with family income below 200% of the federal poverty level who are above the income limit for regular Medicaid. For pregnant women, it's income at or below 154%. And for family MAGI, this includes the adults caring for a child under the age of 18 with income at or below 55%. So eligibility for Medicaid begins on the first day of the month of the application when a person is found eligible. A person can qualify for up to 3 months of retroactive coverage only if they're found eligible for those 3 months. Once found eligible, a child can receive 12 continuous months of Medicaid coverage. After those 12 months, we send out renewals to request updated information on income and resources. So for Kid Care CHIP, clients cannot have insurance for 30 days prior to being eligible. Kid Care CHIP is not available to State of Wyoming employees or employees with access to State of Wyoming benefit insurance. Retroactive coverage is also not available for the CHIP program. And when a client is eligible for CHIP, their coverage starts the month after the application is submitted. So as far as income that counts includes the total tax filer household income, and the size of the household are used to determine income eligibility for a program. The income of some household members may not be included if they are not related to or financially responsible for the child or the pregnant woman. Some types of income are not counted. A 5% of the federal poverty level disregard is given if the 5% would make a difference in the eligibility determination. And we have an automatic calculation in our system for that. Eligibility requirements are dependent upon income, the family size, the tax filer status, and family relationships. Basic eligibility requirements for all programs in Wyoming include Wyoming residency, citizenship, and identity. So application requirements, Medicaid verifies eligibility factors. We collect information on household members, income, and insurance. Electronic sources can verify some information on the application, and that would include information that we have interfaces to. Families are required to submit verifications for anything that we cannot verify electronically that we don't have interfaces for. As far as citizenship and identity, if eligibility staff are unable to verify these through our interfaces, the family members will be required to provide verification such as a birth certificate, tribal ID, or certificates of Indian blood. So to apply, there's several different ways. You can apply online at the website www.westsystem.wyo.gov. You can print the application off the website. You can mail or drop off the application. You can email the scanned applications, and you can fax them. So when we receive an application, we can determine eligibility within 45 days. We send out written notices to applicants that can include retroactive coverage for up to that 90 days. And then families receive their Medicaid card in the mail once they're approved. So a person is eligible for 12 months. After 12 months, a review is completed and eligibility is redetermined. This policy is intended to prevent eligible individuals from moving on and off a program, reduces administrative costs, and improves the likelihood of individuals finding medical home with the continuity of care. Adults can be discontinued before the 12 continuous months if changes in income make them no longer eligible. And this is my information and Kathy's information, and Kathy will be speaking next.
Okay, thank you so much, Jamie. We appreciate that. If we can take just a couple of minutes, if anybody have any questions on children and family category before we move on to Medicare Savings Program? Devin, were there any questions in the chat?
I have a question.
Okay.
She went through that screen pretty fast about their contact information. Can you re-show that?
Yeah.
Oh, I've got mine up. I can show it, Jamie.
Okay, perfect. Thank you, Kathy.
Yep. Okay, can y'all see it?
I think we need one more screen.
One more.
I'm not sure.
So
if
you're
it's
not
on the
able.
next. No, we're on the how does the customer apply? That's the screen that's showing.
Next screen, please.
Next one.
Well, so on my screen, it's showing how does the customer apply. So that's weird.
Okay.
You want the phone numbers for Jamie and Kathy.
There happened to be a cheat phone number, so that way we don't have to be on the phone for 2-3 hours with Medicaid.
No, unfortunately, we do not have another phone number.
What's Jamie's number? I think what we were asking for is Jamie and Kathy's number to be shown up again.
Oh, that one. Okay. I thought
Yes.
you were asking how to apply. So
no,
yes,
thank
you
you.
can contact us, but we are both really busy. So we will definitely help when we need to, but we do ask that you contact the customer service center first. at least make an effort.
And we also do not do the eligibility as far as like processing applications. So that would all be through the main 800 number that's provided when applicants apply.
Yeah, we cannot take an application over the phone because we don't have the ability to take the electronic signature.
Okay. Thank you for that question. Janet, go ahead.
There is a question. We had a Wyoming patient who wanted to apply for Medicaid. She's legally married, but has been separated. Does she need to apply with her husband?
Not if they're living in the same, if they're not living in the same household, as long as it's a legal separation.
So we would just need documentation of that.
Okay, so sorry, that was my question. So if there's no, they do live separately is what she said, because they have 2 homes, and so she lives in one home, he lives in another home, but there's nothing legal that shows that they're separated or divorced. So would she then have to apply with him? I guess he has a partner that he's not married with, that has a child with that partner he's living with now. If that makes sense, sorry.
Well, if they're still, like, is their intention to get divorced? I mean, if they're just having 2 separate households because they have 2 houses, then yes, she needs to include him.
Okay, yeah, she has been saying that there is, but it's been for, I would say, if not 6 months, probably longer, that she has mentioned that they are, but nothing shows that they are. So we were just kind of confused because she didn't want to include him. But before we sent it off, we were waiting for this just to kind of see if we could get an answer.
Well,
and is this going to be a long-term care case?
I'm thinking so. I can definitely follow up with it and ask. One of my advocates is the one who filled it out with her. I didn't. She had just asked me after the fact, so I can see. I would think it is, since she doesn't have any children with her and she's over the age of 19. So that's what I'm thinking it is.
I think it would just come down to receiving that application, and then a representative, whoever gets that application, would take a further look at it. But obviously just be as honest as you can when those applications are submitted.
Okay,
Right.
perfect.
Are they filing taxes together?
That is, they are. So I just looked over at my other advocate. She said that they are. I guess the patient mentioned that they are filing together.
If they're filing as married, I would say she needs to include him.
Okay, thank you.
Any other questions?
There is, what is your advice when Medicaid clients do not hear from Medicaid after 60 days from their application?
Well,
at that point, they could contact one of us and we can look into it, but they can also contact that 800 number to get a status update as well.
And also there's the, if you have questions or answers on our Medicaid eligibility site, there's a Google form that they can fill out too, and that comes to me and I can look into it as well. So
Say that again, Janet.
So we have, and I can send the link, we have a page on our eligibility, Wyoming Medicaid eligibility, that has for questions, and you have questions. It's a Google form, and that Google form comes to me and I get those addressed. So I can either escalate it to our customer service, or I can find, if it's, because I get questions about claims as well, which actually goes to our fiscal agent. So I kind of filter those questions to whichever group needs to address the situation.
Okay, thank you.
Sure. And we also have another one. I have a patient who completed a PE application, presumptive eligibility application, and a full application with Medicaid. Do documents are, let's see, the documents were submitted and confirmation email was received, but the patient never got any letters for Medicaid or cards. And when she called, Medicaid told her she is only on the presumptive eligibility and her coverage would end at the end of April. We are going to call tomorrow, but is there anything she can do to avoid a lapse in coverage?
So I believe Crystal is rolling those forward if they are not getting the application processed, but I would make double sure that they have her full application.
If they don't have the full application and they're not able to find it when that person calls, request that she do the application over the phone at that time.
Okay. Thank you so much for asking those questions and providing those answers. We are going to have to move on because of time. And I just want to let you know that if your question does not get answered in this forum, we will make sure to get the answers for you and then get those answers back to you after the fact. So, and I think there will be some other opportunities too to ask some of these questions, but thank you so much for engaging and asking those questions. We can go ahead and move on.
Okay, thank you. So I'm Kathy Ernst. I am the benefit coordination consultant. My duties are I oversee the state supplement payments. I oversee presumptive eligibility, EID, our premium payment programs. We do a lot of things. So, but I'm going to talk to you about our Medicare savings programs. And this is a program a lot of people don't know they can utilize. And at the very least, a lot of times it will at least help pay that Part B Medicare premium. And so Medicare savings programs are special programs for individuals who are receiving or entitled to Medicare and have limited income and resources. To provide assistance with the cost of Medicare premiums and for those who qualify, assist with Medicare cost sharing and deductibles. That is the goal. There are 3 different Medicare savings programs. The one with the lowest income limits is the qualified Medicare beneficiary, which we refer to as QMB. And Medicaid will pay the Part A and Part B premiums, co-insurance, and deductibles. Most Part A premiums are already covered, but if not, we can cover that Part A. And then we have the specified low-income beneficiary, which we refer to as SLMB. And Medicaid pays Medicare Part A and B premiums. And then we have the qualified individual, which we refer to as QI, and Medicaid pays the Part A and the Part B premiums. So the requirements are you have to be entitled to Medicare Part A and Part B. You have to be a Wyoming resident, a U.S. citizen or qualified immigrant. And then the income guidelines for the QMB is 100% of the FPL. And then for SLMB, it's between 100 and 120, and then up to 135% for the QI program. Resources are pretty high for these programs. For an individual, it's $7,970, and for a married couple, $11,960. So resources are bank accounts, you know, in anything that they can turn into cash. So real property, cash, any other liquid assets such as checking and savings, property, retirement, pension plans. And then there are some resources that are not counted, such as one home if the individual is living in that residence. And vehicles with a motor are also exempt for this program. And the customer can apply in the same fashion that they do for our family and children's programs. Benefits begin for QMB. If you were to apply this month in April, you wouldn't be eligible until May. And then for SLMB and QI, benefits begin on the first day of the application month when determined eligible. And there is no retroactive coverage for QMB, but we can go back to 3 months for SLMB and QI. Renewals have to be completed every 12 months to determine continued eligibility. And then we can close their case if they don't complete the renewal, if they move out of state, if they enter a public institution, if they pass away, or if they're determined no longer eligible. We do screen for other Medicaid programs before we can close their case. We didn't put this in the PowerPoint, but currently we are not closing any cases except if they move out of state, request closure, or are deceased. During the national public health emergency, anybody who had benefits March 1st, their benefits have continued and they will continue. We just got word at least through July 19th. We kind of suspect it may go through the end of the year, but we don't know that for sure. And people on these programs must report within 10 calendar days changes in income, in resources, in residency, or if they obtain insurance or change insurance. And that's what I have for our Medicare savings programs. So we can go ahead and ask if there's any questions for our MSP programs, but before we move on, and this wasn't on the agenda, I do want to tell you about our EID program as well before I move on to Susan, because it is a program that we don't have included in this discussion that can help individuals who are disabled but are working. So, but before then, are there any questions on our Medicare savings programs?
Yeah, this is Joe. I just had a quick question for you. So, so with the QMB, it stands for Qualified Medicare Beneficiary. Now, does that mean that there are some services that are not covered by Medicare that QMB will not cover? Is that what that means? Like dental and other services?
Right. If Medicare denies it, we would not cover it because it's only a supplement to the Medicare. So if QMB, or I mean, if Medicare doesn't pay for something, then we're not going to cover it either. It's the copays and deductibles for what Medicare does cover.
Okay, thank you.
Sure.
Hi, this is Cecilia over at UWFM. Can you please go back over what the SLMB and the QI stands for again?
Yeah, it's qualified individual is QI, and what was
it's specified low-income beneficiary.
Yeah, specified low-income beneficiary.
Thank you so much.
Sure.
Also, I think we missed that we give folks 15 days notice before we remove their eligibility, so they are warned.
Okay, thank you.
Any other questions? If not, I want to really briefly just talk about EID. And EID is a healthcare coverage option for disabled people that meet the income requirements. So if a client is disabled per Social Security guidelines and employed, then we do have a coverage group for them. They do have to pay a premium of 7.5% of their total income. If they feel they're disabled but do not have a disability through Social Security, the Department of Health can actually do a determination for them. they would have to submit a disability application and their medical records, and we could complete it through the Department of Health as well. But this is a coverage option for those that are disabled, and the income guidelines, we only look at their unearned income. So if they have SSDI, as long as it's under $23.82 a month, we don't include their earned income when we're looking at that income guideline. So this is another option that some folks don't know about that we're not talking about in the other presentation. So I just wanted to talk to you about that as well. Any questions on the EID program? If not,
we have a
we can
question
turn.
in chat. We do have a question in the chat.
Okay.
Where can patients access the disability application?
So usually how this is referred is when the customer service center screens an application and a client has marked that they are disabled, the first and that they're employed, they send over a request to Susan to see, are they deemed disabled per the Social Security guidelines. If they're already deemed disabled, then we're good. Otherwise, Susan would send them a disability application, but we can certainly share that with you, Joe, if you want to distribute that to people that are helping people apply.
That would be fantastic. Thank you.
Okay, I'll get that sent over to you.
All right. Okay, great. Thank you. Okay, I think we're going to move on to long-term care now.
Hi, my name is Susan Holt, and I'm the Aged, Blind, and Disabled Consultant for the Long-Term Care Unit. This position was previously held by Kathy. That's why she knows so much. So she's been my go-to for the last 6 months as I learn everything here. Just real quick, want to go back to the question that someone had on a married couple that's not living together. This did come up in the long-term care unit a few months back, and Dana was able to find in the regulations that if they are not living in the same household, we do count them as individuals. So I hope that helps. She's on vacation this week, and I can ask her exactly what regulation that is because she did not put it in the email to me, but if that's helpful, I can find that out and get it to Janet so she can share the regulation with you guys. So the Wyoming Medicaid coverage groups, as Jamie stated, there's more than 50 different eligibility groups within the 3 major categories: the family and the children, the Medicare savings programs, and the aged, blind, and disabled. We have a handout, and Janet, I think you got this handout too to show or to send out. It's the who is eligible for Wyoming Medicaid. It's a 1-page that kind of goes through all the programs, cheat sheet. So not sure if can you see that handout on their screen, or is it not? I don't know how.
Yeah, we can see it, and I did receive that, and I will be distributing that.
Okay, perfect. So this is great because it just kind of summarizes all of the programs, and it's really easy for clients to understand. And then they know what they have to provide for us for these programs. So it saves them a lot of time and a lot of going back and forth. In the long-term care unit, we process Medicaid applications and determine eligibility for the home and community-based waivers, which is the Community Choices Waiver, the Acquired Brain Injury Waiver, the Comprehensive and Support Waivers, and the Children's Mental Health Waivers. We process applications for individuals requesting hospice services, inpatient hospital care, and nursing home care. In order to apply for the long-term care programs, you can mail or bring your application to our offices on 25th Street. We're on the 4th floor. We have our own fax, so they won't go through the mailroom. They'll come directly to us. You can apply by phone, but since we do not have a way to take a telephonic signature, we will be mailing out the signature page for you to sign and return. We also have our unit mailbox email, ltunit@wyo.gov. Our eligibility specialists are broke down by counties, and a lot of those specialists have shared their emails to get the application sent directly to them as well. Oops, did I skip one? No. So when an application is received by our unit, our administrative assistant registers it in the Wyoming eligibility system and distributes it to the appropriate eligibility specialist for that county or nursing home facility. The eligibility specialist will screen the Medicaid application, complete a phone interview with the applicant or authorized representative, and send a notification asking for verifications, or if they weren't sent with the application, or maybe additional information was discussed in the interview that needs to be verified. Once everything is processed, they will send a written notification of approval, denial, or closure. Our application timeframes are the same, 45 days or 60 days when we're waiting for verification, or 90 days when a disability determination is pending. Basic eligibility requirements, so you have to be a Wyoming resident. We do verify citizenship and identity. We verify that we can verify it with the Wyoming driver's license or identification card. And we can also use the revenue information system to do that if we don't get a copy or need a copy. We also can verify with receipt of the Social Security or Medicare. So most of our aged individuals that are receiving a current payment through Social Security, we have an online query. It's the state online query, and we can verify that, so we don't have to try and get the Wyoming driver's license for those individuals. Aged 65 or older, blind or disabled, and that will apply to any of the community choice waiver programs, the inpatient hospital care, or the nursing home. The age limit for the acquired brain injury individual is 21 to 64. If a client turns 65 and is on the ABI waiver, that individual can stay on that waiver. It's just that we can't approve anybody after the age of 65 for that category. The children's mental health waivers cover children from the ages of 4 to 20. And our community choices waiver is for individuals 19 ages or older. We do have some additional requirements for hospital and nursing home. They need to be in the facility for 30 consecutive days, and then we can authorize back to the first of the month in which they admitted. And hospice, they have to complete their 30 days of institutionalization prior to hospice election, or completed an election statement 30 days prior to authorization of benefits. Clinically, our clients need to meet medical necessity, and that's the LT 101 for the acquired brain injury, the community choices waiver, or the nursing home. And that our comprehensive and support clients need to meet clinical eligibility through the LT 104 and the children's mental health. Life expectancy for hospice is 6 months or less, and that's done with a physician statement. And then the client also signs an election of benefits statement. The current income standard for 2021 is $2,382. And this applies to the home and community-based waivers, hospice, hospice, inpatient nursing home, inpatient hospital, and nursing home. So that is the income standard for all of our programs. If an applicant's income exceeds the income standard for the nursing home or waiver programs, they can still qualify for Medicaid by completing an irrevocable income trust packet. And it's a model trust that was established for use by clients, so that they don't have to go out and get their own trust. We require that they use ours. And only income of the applicant is deposited into the trust, and a separate bank account must be opened in the name of the trust when the client would want eligibility for the waiver program. If the client is requesting nursing home program, they only have to open an account if the applicant's income exceeds the Medicaid rate for the facility. And our eligibility specialist would help them determine whether or not that was necessary if they were in a nursing home, because those rates are available to our department so that we can check for that. Unfortunately, for inpatient hospital and hospice, we can't do an irrevocable income trust. They have to be below the 2382 income standard. Verification of all income declared on the Medicaid application is required. For Social Security payments, we can verify those from the SOLQ, the state online query. Other pension and retirement plans, we do request that they provide a letter, an employer statement, company statement, or an award letter listing the gross amount of the pension and any deductions. And for earned income, an employer statement or current wage stubs for a 30-day period. The resource standards for an individual are 2,000 and for a couple of 3,000, but we can always put the standard if it's more beneficial to count them as two individuals, we can always use the $2,000 resource standard for each. If only one of the couple is applying, the spouse that remains in the community is allowed a $130,380 spousal allowance. Verification of all resources declared on a Medicaid application is required. Interfaces and other tools are available to help us identify those resources. We have an asset verification system, and this system allows us to identify any bank accounts for the applicant in the 5 years prior to the Medicaid application. We use the revenue information system to identify any currently registered vehicles or vehicles that have been sold for the client. And we use the county tax assessor's websites to look for any property that might be owned by the applicant or client. I do have some fact sheets, and I believe she sent those out as well. And so we have one for the Medicare savings program, and it again just goes through the standards for each one of the programs and how they qualify. We normally run this front to back, so just a handy sheet to have for clients to pick up to see if they might be interested in applying for a program. And then the Employed Individuals with Disabilities program that Kathy went over. And then I have the Medicaid and Kid Care CHIP programs for children that Jamie went over. I have our community choices and home-based and community-based waiver programs, whether they want to receive those services in their home or in an assisted living. Goes over those in requirements for that. And then we have the nursing home fact sheet. Talks about what they need to do to qualify for nursing home coverage. And then we have the hospice fact sheet. So any questions?
That was quite a bit of information. Thank you so much, Susan. I did have a question, and it had to do with the estate recovery program. Some clients are a little hesitant to apply for certain services after a certain age because of that. Could you just real quick explain it to us what that is?
So Sheila McInerney is our third-party liability and estate recovery specialist. The Medicaid long-term care programs are subject to estate recovery. So a client that applies that has property and receives Medicaid benefits through those programs, we would recover if they have a home, but only after they pass away. A lot of times I refer the families to work with Sheila because she will help them through that whole process, especially if a family member has been paying maintenance or upkeep on the property, taxes, homeowners insurance, so that they can make those allowances in closing. You know, when the property goes up for sale, Sheila takes a look at all of their receipts, and we can allow then a family member to be paid back along with the lien. Our Medicaid would receive partial money then too. So a property can sell for 80% of the fair market value. So we've had that happen too, where a family member wants to purchase the property and keep it in the family. And so as long as they can show us either through a comparable market analysis or an appraisal that the family members purchasing the property for at least 80% of the fair market value, they can do that as well. And then the remaining funds, the client would have time to spend down.
Okay. Wow, that's great. Great information. So it's really only at the time that the estate is liquidated that the lien goes into effect. Is that correct? So
That's correct.
Okay. So if there's like a living spouse still living there or a child living in that home, it's not going to be automatically liquidated or surrendered because of estate recovery. Is that correct?
That's correct. And there's other, if it's a disabled adult child, there's another caveat to that as well, because if it's a disabled adult child, there's that child could potentially inherit the property without the estate recovery happening at the time that the client passes. And that's why I would refer to Sheila so she could let them know all the rules about that piece of it.
Okay. All right, great. Are there any other questions about long-term care that anybody has? You can put it in the chat. We've got just a few minutes left. It's 2:53, and we certainly want to take some time for the survey also. But if there are any other questions, please feel free to ask.
Joe, while we're waiting for questions, can I just say a few words?
You certainly can. Sorry, I missed you earlier. Forgive me, please. I'm
No
sorry
problem.
about that.
No problem, Joe. So I'm Jan. I'm the executive director here at the Wyoming Primary Care Association. And we are so lucky to work with the community health centers in the state. The people on the phone are some of my heroes, people who meet with patients every day. And we so appreciate their work to help patients find access to care. I also really want to give a big tip of the hat to Janet and her team. Just really appreciate you guys taking this time to work with us and establish these relationships because, you know, at the end of the day in Wyoming, it's all about the relationships that we have. And so I've seen in the chat that you're adding your personal information for contact, and that's just worth gold for us. So I just really appreciate that and just wanted to talk about quickly, you know, just that the community health centers are federally funded and they do not turn anyone away for care. But obviously they're not a free clinic, and so they want to help their patients get access to whatever means available to them to be able to continue to seek care and get the care that they need. So that's a quick snapshot to an earlier question, and I just really appreciate everybody being here today. Thank you.
Thank you.
Yeah, so and just echoing what Jan mentioned, I want to thank you, Janet and Kathy and Susan and Jamie for your time and those great presentations. I'm sure there's going to be many other questions that come up. We will have an opportunity to pass those on, I think, at a later time and get some answers to those. So be looking for that from us to send over to you. And I just wanted to say too, we've got just a few minutes left for the workshop. There is a survey in the chat that Devin put in the chat. Please fill it out. Please take the time to fill it out, and it would be very much appreciated if you do that. Also, if there's anything in particular that you heard today that you would like more a more in-depth training on, there's a space in there, I think, to be that you can fill out. So please do that too. And Janet, did you have anything else you wanted to add while we're doing all that?
No, just that we are constantly changing, like everybody knows. So, you know, if something comes up, you know, feel free to send us an email, call us, and we'll, you know, try to give you the information. As we mentioned before, we're currently under the public health emergency, so that's helping staff. And we are working with our customer center to, I realize the call times have been long, and that's one of my jobs with my boss, is to get those times down and get more applications processing quicker. So I'm sorry that everybody's a little bit frustrated with the long times, but we're trying to get those taken care of. So, but yeah, feel free to reach out to me as well. I did put my information in the chat. I'm always available to see what I can do. I might not be able to answer the question, but I'll find somebody who can.
Well, in case you're not monitoring the chat, Janet and team, there's lots of thank yous in there. Carrie says, thanks for all your help. It's invaluable to have some contacts to reach out to discuss difficult situations or help with particular cases. So just so you know, we're really appreciative of you.
Well, thank you.
And I want to say thanks for Renee joining us today too from CMS in Denver at the Office of Regional Operations. And this was a great call. I just appreciate everybody.
Thank you.
Thank you very much.
Feel free to reach out with other questions. So thanks for the opportunity to provide information.
Thank you. Thank you very much.
And our unit, our long-term care unit, has a few open positions that are currently recruiting for. Once we get those filled and get some caseworkers assigned to different counties, I can get the assignments to Janet. She can share them all with you guys, and that way you'll have somebody to actually call on a long-term care case, a direct person to deal with.
Sounds good. Sounds good.
And I did, there was a question earlier, I think in discussions with you, Joe. If you are assisting a client and they're willing to have you as either as a facility or you personally helping them with the application, you can become an authorized rep so that we're able to discuss their case with you. If it's a facility in general, if we could get the names in that facility so that our customer service also knows that they can speak to you regarding certain cases, that's also appreciated. So.
Okay, great. Good information. Great information. Well, we have just a minute or so left. If you have not yet filled out the survey, please do so. And I want to thank all of you for attending today. Hopefully we can bring more content like this in the future on other subjects. And we certainly want to do that for the benefit of the health centers and to increase your knowledge and your ability to assist your patients. So thank you very much for attending.